Hi, my name is Akash Mukundara Ugle. Today we will discuss about the various terminology used in the PV. PV means pharmacovigilance. Which terminology means definitions most important used in pharmacovigilance. There, there are several definitions or terminology used in the pharmacovigilance. Then we are discuss about the first, what is meant by pharmacology. What is meant by pharmacovigilance? Pharmacovigilance is a branch of science which activity related to the detection, assessment, understanding and prevention of adverse event or any drug product related problem is called as pharmacovigilance. Then second means adverse drug reactions. Adverse drug reaction means is nauseous, unintended, unwanted effect of the drug which have causal relationship between the suspected drug or adverse event is called as ADR, means adverse drugs reaction. Then third, we are discuss about the adverse drugs event, means ADV. ADV similar likes to the adverse drugs reaction, means adverse drugs event is a nauseous unwanted effect of the drug, but they may or may not have be causal relationship between the suspected drug or adverse event. Main difference between the ADR and adverse drug event means drug is directly produced, adverse drug reaction directly produced to the drug, but adverse drug event not directly produced to the drug. Then fourth terminology mostly used in the pharmacovigilance is causality assessment. Causality assessment means causality assessment is a relationship between the suspected drug or adverse drug events. Then what is meant by serious adverse event? Serious adverse events is a process, means adverse is a reaction result in the death, inpatient, long-term hospitalization, life-threatening conditions, disability. This is the serious adverse event. This is a few most important terminology used in the PV. Then we are discuss about the basic terminology, means what is meant by MEDRA, ICSR, spontaneous reporting. Then what is meant by drug, what is meant by past drug, what is meant by signal. The first we are discuss about means what is meant by past drug. Past drug means discontinuous or completed prescription written by the patient, written by the physicians, mean which medicine to stop by the patient is called as past drug. Then signal, what is my signal? Signal is the information to produce the adverse event, means signals means provide the proper information, provide the information about the adverse events. Then what is meant by spontaneous reporting? Spontaneous reporting is a voluntary reporting. This is submitted by the MHA means marketing authorization holder, or any means healthy volunteer means physicians, nurses, pharmacists to the center of pharmacovigilance means is called as spontaneous reporting. Then we have discussed about the what is meant by MEDRA, WHO DD means then ICSR processing, what is meant by COMS forms. The first we have discussed about the what is meant by MEDRA. MEDRA is a medical dictionary of regulatory authority, is a clinically validated international terminology used by the regulatory authority and pharmaceutical company. During the regulatory process means pre-clinic, post-marketing and pre-marketing is data entry, evaluations and validations. MEDRA is types of dictionary to use the code of adverse events. Then WHO DD means WHO drug dictionary is a type of classification of medicinal dictionary. It is developed by the WHO International Programming of Drug. Then WHO DD monitor and maintained by the Uppsala Monitoring Center. WHO DD is used by the CRO means clinical research organization, pharmaceutical companies, regulatory authorities for the identify the drug in spontaneous reporting. Then we have discussed about the COMS means Council of International Organization means Medical Sciences. COMS is an international non-governmental non-profitable organization. COMS provide the platform for the discussions and provide the ideas related to the medicines and pharmacovigilance. Then we discuss about the ICSR. What is meant by ICSR? ICSR is a individual case study report, is a safety service document in which document the material required for to the reporting of adverse events, adverse drugs reaction. This is the basic terminology used in the pharmacovigilance. We first discuss about the what is meant by pharmacovigilance, spontaneous reporting, what is meant by past drug, signal, ADR, ADE, causality assessment, MEDRA, WHO DD, then rechallenge. This is all about the terminology used in the pharmacovigilance. Thank you.